Antibiotics or antimicrobials are possibly one of the most useful and the most improperly used things man has ever made. Hundreds of years ago, a bacterial infection meant death. During the Civil War, doctors would have to amputate a lot of limbs because the mini balls that were used during that time would shatter any bones it hit, causing too much damage for the doctors of that time to fix. So instead, they had to amputate. However, more people died of the infections that resulted from the procedure than died from the actual war. As you can see, bacteria is pretty deadly and antibiotics are pretty useful. However, bacteria started to become antibiotic resistant, and that's a real problem. Antibiotics were first discovered when Alexander Fleming decided to find a better antibacterial agent after seeing the effects of World War I. One day, when he was working in his lab, he noticed that one of the petri dishes he was studying had mold in it, and the bacteria around the mold had died. This was an important step to eliminating bacterial infections and reducing them to an uncommon, if not rare, occurrence. Another important step was proper hand washing among medical practitioners. Hand washing among doctors was pretty common even before the 1840s. However, most doctors weren't washing their hands properly. Most doctors were using regular soap and water, and while standard soap is fine for general hand washing, it just didn't cut it for medical purposes, and the doctors would still spread infections among their patients. It wasn't until 1847 that a man named Ignaz Semmelweis developed a method of hand washing that would prove suitable for medical purposes. This method involved using an antibacterial lime solution in place of the lye soap that was popular at the time. This proved very effective, reducing the maternal mortality rate of one hospital to less than 3% from the previous 16%. This again proves that bacteria is pretty deadly and you should probably wash your hands. However, bacteria are starting to become resistant to antibiotics, which is a big problem. Bacteria becomes resistant to antibiotics when people try to treat their own sicknesses using old medication or not following their doctor's orders. Imagine you had some sort of sickness or infection and your doctor's prescribed you an antibiotic that you're supposed to take for 10 days. You follow the prescription, and on the 6th day you feel fine, so you don't take your antibiotics because you don't think you need it anymore. So now the bacteria in your system that haven't died from the antibiotics are now immune to the antibiotics, and they can pass that trait on to all their little bacteria buddies. As you can see, becomes a real problem as it can pass on the trait to any bacteria, no matter what species that bacteria is, which raises the question, how do we stop this? This is a pretty easy question to answer, as the solution is not to use antibiotics unless prescribed to do so by your doctor, and then to follow the prescription to the letter. Proper hand washing.